All right, I do want to be conscious of everybody's time, so we are going to get started. One last time, let me give those instructions in Spanish for those folks that are joining us, and then we will get started. Para la gente que está entrando, gracias por acompañarnos. Recuerden que la sesión es en inglés, pero tenemos a nuestro compañero Juan, que nos está haciendo el favor de hacer la interpretación al español. En pantalla pueden buscar el icono del mundo donde dice interpretación. Por favor, háganle clic y pueden entonces escuchar la voz de Juan dándoles la interpretación al español. Si no ven ese icono en pantalla, por favor, háganle clic a las tres bolitas donde dice More o Más. Y en ese menú van a ver entonces el icono del mundo que dice Interpretación. Háganle clic y pueden escuchar la voz de nuestro compañero para poder comenzar la sesión. Muchas gracias por acompañarnos. Thank you, everybody, for being patient as I give instructions in Spanish. So welcome, everybody. My name is Berenice Pan, phase manager for Chicago Public Schools. Been with the district for a long time, but I'm also alum of Chicago Public Schools, proud alum. I'm also a mom of a sixth grader, a 12-year-old, almost 12-year-old. Can't believe it. My munchkin's a preteen. So as you know, we're putting these together for us parents or community to get some of these questions that we have answered. So I'm going to thank everybody that is here today. But first, let's do a couple of housekeeping instructions for you guys. As you know, we're going to be recording this session just for those folks that are not able to join us because they're still working, or they're dealing with the kiddos at home. So this will be up in our YouTube channel by Friday, latest Monday. So be patient with us as we upload those things into our YouTube channel. Today we have two guest speakers with us. You guys know Dr. Fox, but we also have Dr. Patel, which we'll do a quick intro in a little bit. As you guys know, you RSVP for this session, and we are going to get started with a short presentation and then with the questions that you guys submitted via the RSVP. We will open the Q&A for you guys to put additional questions in case you heard some information and a new question popped up. We are going to try to get to those, but we might not. So just know that ahead of time. And if we're not, we will let the people, Dr. Fox's department know what kind of questions you guys have so that they are able to answer those for us at a later time if we don't get to them today. Okay. Today's session, like I said, is vaccine safety and why it's important. I know a lot of you guys have a lot of questions of what's going on, what's the vaccine, should I get it? So we're going to hopefully today try to answer some of those questions. But before we do get started, I want to mention that next week we are going to have Chicago Public School, our social emotional office learning. So come and join us. I know a lot of you guys are doing some curriculum with your kids and learning what social emotional learning is. So join us next week to learn a little bit more or ask your questions of what that is and how you can do it with your kids and how you can support them now that they're home and when they're going to return to school in person. And our speaker today, like I said, we have Dr. Fox, who many of you guys know, but we have someone else too. We have Dr. Patel, who's going to be joining us today. So we're very grateful to have her with us tonight. As you guys can see from her bio, she's one of the physicians coming to us from Washington, D.C. She has worked with a previous White House President Obama. So we are very grateful to have somebody, right, that has all this knowledge, not just here in our city, right, like Dr. Fox, but that can actually see what's happening in our nation and what's happening out there in the world. So we're very grateful to have her with us. I'm going to let her introduce herself a little bit better because I know I don't do justice with her bio. And then also, Dr. Fox, I want you to introduce yourself a little bit better too. I know some of our folks know you, but for some of those people that are joining us that haven't met you before. So Dr. Patel.
Great. Thank you, Berenice. And I just want to thank everyone for joining. I know that it's just a hard time right now. I'll keep it short. Kavita Patel. I am a primary care physician in a community health center in the DC area. I also spend a lot of my time on policy. And what's most relevant to kind of this audience is that I have kind of spent my life, I have a public health degree and spent my life in pandemic preparedness. I'll be honest, all the pandemic preparedness we had done had never really truly prepared us for where we are today. But it has given me kind of time and experience after Hurricane Katrina and a number of like natural disasters, as well as kind of the threats that we've had in the past, H1N1, Ebola, and West Nile virus. And so there's been a little bit of understanding, and some of what I hope to bring today is just basic information that can tell us, where we're at. And then as I'm a parent, as parents, as well as people who are just trying to navigate what the coronavirus kind of means for 2021. So thank you, and very excited to be here, especially with my other esteemed co-presenter.
Thank you, Dr. Patel. Dr. Fox?
Well, hi, everybody. I'm Dr. Kenneth Fox. I am the Chief Health Officer of Chicago Public Schools, and I've been a pediatrician for over 3 decades. I've been the chief here for a little over 4 years, and I am delighted to be with you and delighted to welcome our special guest, Dr. Patel. I'm kind of starstruck, to be honest with you.
I think we all are, Dr. Fox. I'm with you. I'm on that same bus with you.
Yeah.
Thank you, Dr. Fox. So I know we're going to get started with a short presentation that you, Dr. Fox, and also Dr. Patel put together for us, just to give us some background information before we get started with questions. So let me share my screen one more time to get that up. All right, and I think if my computer wants to work today, we will get started in 1 second. There you go. And I think, Dr. Fox, I think you start.
All right, sure. Why don't I just quickly share what I prepared. This is going to be super brief because we have this special guest and we have to get to all your questions as well. But I thought it might be good to frame our discussion to some extent and to place it in the now. There has been a lot of big news of late, new guidance from the Centers for Disease Control and Prevention. And so I'm going to just touch on that before I turn things over back to the moderator and to Dr. Patel. Let's go to our first slide. So basically, I'm just trying to say, here's where we are. Okay, the CDC recommends that schools across the country offer in-person learning, especially for younger students. To help make this happen, they recently issued new guidance for safe return to in-person learning. There are 2 take-home messages that I want to leave you with. The first is that the CPS reopening plan, it matches the CDC's new guidance. We have this covered, is what I'm saying. The new CDC guidance does not call for investments or policies that are not already part of the district's plan. That's a really important point, and I wanted to make sure that I brought it to you. The second key takeaway message is this, that it's critical to stick with the fundamentals as shown in this slide. This is about the fundamentals, those fundamental layers of protection for all schools, okay? We're talking the big 5 here from the CDC: cloth face coverings, social distancing, clean hands, clean spaces, and contact tracing. This is important, and my team's been at it for months, really since last March, because what you want to do to contain the infection, contain the pandemic, is send the cases to isolation and send the direct contacts of those cases to quarantine. That's really the point of contact tracing, and that's exactly what we're up to. Let's go to the next slide, please. Thank you. All right. So this is part of what I was talking about when I was mentioning the new guidance from the CDC. This is about the different COVID-19 transmission levels. So while they say it's important that reopening to in-person learning happens, they say at the same time is that different levels of COVID transmission risks call for different actions to be taken by schools to stay safe. So to figure out what schools should do, we look at new cases and we look at test positivity rates. And this is depicted in the slide. In Chicago, right now, we're in with regard to new cases, we're in what's the orange category. That's the one, you see the third one there, substantial transmission, okay? There's substantial transmission in the Chicago community, and that points us to this level, okay, the orange level. At the same time, it turns out that our test positivity is actually in the low transmission level, which is great news. I think we're at 3.5% today. That's where we are now. So what happens when you have this sort of mixed picture or split decision, you go with the higher one, okay, just to be on the cautious and the safe side. So we say that we're in that orange category, okay? And what this means for CPS is that we should be using the hybrid model, some in person, some remote, so that kids can maintain that important social distance and learn in school in pods. Okay, pods, you know, are these small fixed groups that stay together over the course of the school day. And this is precisely what we're doing. So let's go to the last slide here for my section. And it's just about what we know. We know much more now about kids and COVID in schools than we knew, let's say, last March when we had to close. Okay, and this slide depicts, it's sort of like, here's the latest in terms of the scientific consensus about this. There's been very little evidence that schools have contributed meaningfully to increased community transmission. That's the conclusion that people have come to on the basis of scientific research that's happened globally, that's happened nationally, and that's happened locally here. So that's really where we're at. I'm sorry. Stop. Okay. Oh dear. There we go. All right. So that's where we are. This is where I want to leave it. So there were just a couple of key messages, and then the conclusion here. This is where we are. Let me turn things back over to our moderator and then on to Dr. Patel.
Thank you, Dr. Fox, for that information. I think it's great. We just have to keep reminding us, right, of what we need to do, because sometimes we forget. So thank you so much. And I know, Dr. Patel, you had a couple of slices as well that with some information that we should be aware of. So
yeah, great.
I'll
Thank
go
you.
through them. Yep.
Yeah, thanks, Berenice.
Mm-hmm.
All right. Great. So I wanted to go ahead and just, you can see a little bit, I can't help it. I used to teach as well, so I have to have an agenda slide. So state of the pandemic, we'll talk a little bit about vaccines and some myths around the vaccines, just because I constantly find myself facing, even after talking to families and patients, a lot of very, very important questions. But it takes time to kind of process all the questions you have and then to really understand and respond to the answers. Children in the vaccines, and then just a comment about the variants. You can't pick up a newspaper, turn on a TV, listen to the radio, or open your internet without seeing something about the variant. So I just want to try to talk about them a little bit. Thank you. Next slide, Berenice. And I don't have that many slides, so don't. All right, so the current state of the pandemic, I'm going to try to actually be really cognizant. I've looked at Chicago's numbers. They follow the trends that I'm talking about, that daily cases in the United States, as well as globally, have fallen. The United States is still responsible for the majority of cases across the world, disproportionate to every other country. But even in all parts of our country, we've seen cases falling about 41%. And it's been in that steady amount kind of week over week. I added here that New York has not seen the declines that the rest of the country have. They're declining, but not at the same rate. And the only reason I bring that up is something to look at, is that that might be the role of these variants in kind of slowing down that decrease. And that's exactly where I think you're seeing a lot of public health experts, virologists, infectious disease folks saying that, we are definitely in a good period of trajectory. We're not increasing, we're decreasing, but the rate of that decreasing will depend on the activity of variants across the country. All right, next slide. And I put some other stuff in there about UK and India, but okay. Vaccine supply and distribution. I'm just going to state this very bluntly and clearly, that I think it is incredibly frustrating kind of what the vaccine rollout has been from the start, and I'm not going to try. This is not meant to be political in any way, because it's not political. It's just disappointing writ large. And there are probably people on this webinar right now. I have family members who are desperate to try to get the vaccine, even though they're in the eligibility group that's open in their states or in their cities. And it's so frustrating that, in addition to that, we're having these conversations about, who's prioritized, our teachers prioritized, our school staff prioritized. And I think you can tell from my background, I think I'm here to say that, like, the science, as Ken mentioned, that Dr. Fox mentioned, the science supports being able to do things to keep both children and adults safe. But it is clear that we need to get teachers and staff vaccinated, not just teachers, educators, and all the staff kind of that make up the team. And I think that's where the rub is, because there's a tension about whether or not you can safely reopen a school while you're going through the 2 doses of the vaccine. And I think we can talk about that in the Q&A, but I also think it's important, we'll talk about this a little bit. Some of you might have children who are in the eligible age category that I predict we might be in by the end of the year for the fall school year. So I'll talk about that. In terms of like vaccinations and kind of where they are in each state, almost every state, including Illinois, is kind of still in like the higher priority healthcare personnel, long-term workers, and essential kind of frontline essential workers that are defined differently state to state. It's been very clear in Chicago that teachers are one of those frontline kind of essential workers. But just saying that they are and then helping people get vaccinated is not necessarily that easy. And then the weather delays, I just want to make a point out of this, because both UPS and FedEx actually have their main main shipping facilities in the southeast part of the United States. They have experienced massive setbacks, and you've been seeing delays across the country with shipments of vaccines. So we were already desperate to get more vaccine, and we're having even more challenges because of, the snow NATO. And I know it's hard to talk to Chicagoans about, snow in Texas, but it is something, as a Texan, it's devastating to get snow. And obviously the power outages aren't helping, but shipping has been affected across the country as a result of this. Next slide, Berenice. So where are we with the vaccine? I'm just going to cover this. I'm not going to read this to you all because this might be of interest in the Q&A. The vaccine, so very common question, taking the vaccine might actually give me coronavirus or COVID-19. No, and here's I like to have, I like to use the rule of thumb that if I could explain it to my mother, then it's easy to explain. So I'm going to tell you what I told my mother, because she's, by the way, come at me with all these questions. I've told my mother the 2 currently authorized vaccines, Pfizer and Moderna, are messenger RNA vaccines. And that little m, messenger, is actually a good way of remembering what they do. They act like a messenger and deliver a little package of like an RNA sequence that tells your cells to make a spike protein, and then to realize that spike protein is not supposed to be there and actually develop immunity against it. And then, like a good messenger, it delivers a package. The package kind of gets opened and taken apart, and the messenger gets out of your house. And that's exactly what the messenger RNA vaccines do. They do not give people the coronavirus, and they do not give you any exposure that is the virus itself. Another myth has been around the serious or kind of unusual side effects. We now have tens of millions of Americans who've received the vaccine, both doses, including most healthcare workers, and including probably Dr. Fox and myself, who have received it. I was lucky. I cried when I got my first shot. So it tells you kind of how emotional I get. But I think the side effects now we've been able to monitor worldwide, and they're incredibly rare. They are there. And what I tell people is that you're really looking for the most serious adverse events, which is usually anaphylaxis, closing of the throat, not being able to breathe, heart racing. And 86% of the people who had that had it happen within the first 15 minutes after the shot. So if you get your vaccine, you will be very familiar with someone asking you to sit somewhere and wait for at least 15 minutes. And if you've had a history of allergies, mention it. And they might ask you to sit and wait for 30 minutes, but it is incredibly rare. Side effects are very common and should be expected. It's that messenger that's giving you that kind of immunity kind of signal. It's getting your immunity system to work up. So for the first shot or the second shot, it can be normal to have localized side effects, including soreness and sometimes redness at the site of the injection. My first time, I had a hard time lifting. It felt like I had a workout of my muscle, but I hadn't worked out. And then on the second one, I did experience about 36 hours of what I'd call flu symptoms, low-grade fevers, and just really feeling awful. So it's something to take into consideration for both doses to make sure that you're not overexerting yourself or not overscheduling yourself kind of the day after. And then there's a lot of controversy around the next myth around only having one dose. These are 2-dose vaccines. We will hopefully have, if I were to come back and talk to you in a month, we would hopefully have another vaccine authorized by the FDA, which is a 1-dose vaccine from Johnson and Johnson. But right now we have 2, and it's incredibly important to take both doses. There's a lot of kind of media and skeptics, kind of like, well, we only need 1 dose, you get enough immunity. The trials were done with 2 doses. And if there's one thing any scientist will tell you, is that the best information we have are from those really rigorous trials. So both doses matter. And then the biggest one is this last one. I think it's frustrating. After you receive your vaccines and it's been, you generally get the immunity really starts and peaks. It starts at 2 weeks after that second dose. So after you get vaccinated, is it safe to stop wearing masks? Unfortunately, the answer is no right now, because in general, we do not have enough data to know whether getting the vaccine means we can safely not wear a mask because we won't give the virus to people. Because the vaccines are helpful at protecting you from dying or being severely ill in the hospital, the trials were not set up to see if the vaccine prevents you from getting the coronavirus in your nose, but not getting sick, but giving it to Berenice if I'm standing next to her. So we're asking everyone. And when I go out in clinic, I do exactly what I've been doing before. You wouldn't even know I was vaccinated. What I have done, just to let people know, what you can do is if your household has been vaccinated, or my elderly parents who have been vaccinated, if we can all get together safely, we can have a household gathering knowing that the risk is not 0, but I would feel safe hugging my mother and doing some things if our whole household is vaccinated. Children are not eligible right now, so we'll talk about that in a second. Next slide, Berenice. So this is just the lineup of the current vaccine manufacturers. I offer this just to show that there are really kind of in the potential for 2021, 5 manufacturers. The original Operation Warp Speed from the federal government had contracts and research and development funding with 12 manufacturers. We still have 10 of those manufacturers are still in the vaccine business. 2 didn't have any real success in the beginning, so they dropped out. The 5 that you see on this slide, though, are the most promising, with Pfizer and Moderna receiving authorization. You'll hear me say this a lot. I used to work in the government. So authorization is not the same thing as approval. These were all, normally a vaccine would take several years to receive a full approval because of the urgency of the pandemic, but not the urgency of the trials. They received an emergency use authorization. And what that technically means is that the benefits outweighed the risks of the vaccine. The risks are low, but they're not 0. The benefits are incredible with almost 100%. You can see here I have in that fourth row that says reported efficacy in severe cases, 89%, 100%, 100%, 85%. That's the reduction of risk of getting severe COVID if you're vaccinated. And that's why I cried when I got it, because it is incredible to think that even if you catch COVID, because you can, think of it like the flu shot. Remember, you hear a lot of people, maybe you got your flu shot and you still got the flu. That's actually true, because the flu shot protects you from getting really sick from the flu, but it doesn't stop the flu virus from coming in and trying to take over your body. It just keeps your immune system ready to punch the virus if it comes in. Same thing with the COVID vaccine. So we will have people who will get positive tests, or actually even potentially get mild symptoms after their vaccines. But that reduction in risk from severe illness or death is incredible. Pfizer and Moderna have already been authorized. The next one that'll be likely to be authorized, because it's going in front of the FDA next week, is Johnson and Johnson. And then Novavax is likely to come after that. And then AstraZeneca receives a lot of attention because it's pretty much being used in the rest of the world. There were some issues with the trials in terms, they're still finishing their data in phase 3 in the United States. And the trials from the other countries are just not good enough to kind of make us feel comfortable to have them authorized at this time. But I do predict that they will be in a place by the end of the year, most likely. And then there's a host of other vaccines around the world that you might read about, but I'll go on to the next slide just for time. So children, all right, so this is kind of everything we're all really, really kind of worried about. So vaccinating children will actually be important because 25% of our country are kids and 27% of the world are kids. And generally speaking, out of safety, children are the last group to be tested in clinical trials. And that there's a good reason for that. As Dr. Fox will remind you, children aren't just little adults. Children are different and their bodies are different. And sometimes the way they react to things are different. So what's good news, Pfizer has been approved for 16 and above. I know some of you might have adolescents, so they can actually get vaccinated when it's their turn soon. And Moderna and Pfizer have both been testing the vaccines in ages 12 and older. Pfizer has closed because they had enough people in their 12 to 16 cohort. We should be seeing some data in the next several months. So we could actually potentially even see an authorization for the ages 12 and above in the next 3 to 4 months. And then Moderna is still enrolling patients. It's actually having trouble enrolling people. And this brings up, just something to put out there that, children are needed for research. And so it's a conundrum, but something I think that families, if you are approached, ask a lot of questions and consider participating in a clinical trial, especially families of color. This has been a priority for the federal government to make sure that, given all the failures of the government to include a diverse group of participants in trials, I can tell you right now, 1 in 3 clinical trial participants between Pfizer and Moderna were non-Hispanic, were not white or not non-Hispanic. And so it's incredible to see diverse. I didn't believe it until I went through the data. And then AstraZeneca in other countries have started a trial on children between ages 6 and 17. So that'll be incredibly important to give us some signals about children lower, do they need half doses? Do they need both doses? So that'll be important information. So that, I just want to say though, given what I'm telling you, what they'll go is kind of in the United States, they're doing 12 and above. Then the next age group is 6 to 12, and then 2 to 6, and then under 2. So if you've got young children, I've got kids 4 and 6. I do not think 2021, there's even going to be any hope of having my children have a vaccine. So I just say all that because this factors into risks and consideration about benefits and risks about attending school in person, or how your children are going to be thinking about the virus because they will not be vaccinated, but they're in your household and you all might be vaccinated. You might want to have Christmas or Thanksgiving or holidays and how that impacts it. Next slide. And I think I'm almost done. So I know I'm talking a lot. Variants. This is the last slide. I actually, just as a little bit of I tried to do this and I didn't do it on the slide. I had been really referring to these by the countries of origin: UK, South Africa, Brazil. And I think a lot of us in the scientific community are trying to shift from that and refer to them by the numbers because, one, it's creating unfortunate stereotypes. And these countries didn't do anything wrong. They just happened to be the countries where we first detected these variants. We now have all these variants everywhere. So I have the flags there, but I want people to really try to kind of, not let that be a conscious bias about how we're feeling. We're already seeing anti-Asian sentiment because there had been erroneous labels of coronavirus as the China virus. I don't want to see any of that but get propagated. Having said that, America, we like to grow our own variants. So we've already got our own variants that are highly transmissible: California variant, the Louisiana variant. So we have a number of variants. The ones that are on this slide have been the ones that have received the most attention and caused the most concern. The one that we think originated from the United Kingdom, B117, is of special concern because it is the one that came to the United States through many ports of entry. And because the UK is so close to New York and other places, it had an incredible hold here, probably as early as December and November. There's actually proof that we had these variants as early as kind of the surge, November, December. But the CDC has released some modeling that predicts that the B117 variant could become the dominant variant by March. That's right around the corner. Why is this important? 2 reasons. Good news. The vaccines all work against all of these variants. You will see news reporting that I'm part of sometimes, where you will see that the vaccines might not be as effective against the South African variant or B1351. Good news, the vaccines are so effective that even not being as effective is still more than what you would need to neutralize the virus itself. So I'm not trying to sugarcoat it. These variants do signal to me that as much as I would love for COVID to go away and never be here and be done forever and ever, and nobody ever wants to hear me say the word COVID ever again in my life, we are going to have to live with the coronavirus probably for the rest of our lives in the form of these variants, and then developing probably some sort of seasonal or regular vaccine schedule. And the manufacturers are already working on that. The bad news is that some of these variants, including the B117 and some of the California and Louisiana variants, are considered more transmissible. And in some cases, we have some data to show that they might even be more deadly. How? They are more transmissible because there are mutations to that nasty little spike protein that we've all unfortunately gotten used to seeing on the coronavirus that make it easier for that spike protein to bind to receptors in our body. And they are very smart because they are also able to kind of stay in the body longer. And so therefore, more opportunities to infect others. But I am not as dire in my predictions about where we're going to go, because I think as the cases are coming down, there's less humans for the virus to kind of reproduce itself in. And as more people get vaccinated, then there's more protection, whether you can call it herd immunity, whatever you want to call it. We're getting to be, we need to do better. I wish we were vaccinating 24/7. But it looks like we're on track to hopefully get the majority of the country vaccinated, hopefully by June, July. And so that's going to be how we kind of defeat and put a brick wall across these variants. What that means, though, is that we might see a fourth surge in our country. It should not be anywhere near as severe as this recent surge. But I don't want people to think that when we start to see an increase in cases, that spells some sort of disaster. It just means that, like all things, there's kind of a seasonality to these viruses, and especially with these variants, we will likely see a little bit of an uptick in some parts of the country, possibly the Midwest, Northeast, South, Southwest. It could be everywhere, or it could be regional, which is what we saw in like the March, July. If you'll remember, Chicagoans remember that we had parts of Illinois that got really hit, and then parts of the country that got hit several months later. So that tends to be the pattern that we see. All right, with that, I will stop because I'm sure there's great questions, and we're here to hopefully be a resource.
Yeah, no, thank you so much, Dr. Patel. That's a lot of information. So I'm going to give people a minute to kind of like digest that and think about all the information that you gave, which is great information. I have a 12-year-old, so as you were talking about the vaccine, I was getting just excited for my kid at some point to be able to get it. So thank you so much. And like we said earlier, some of you guys that are joining us today did send us some questions ahead of time. So we're going to kick out with those, and then if we are able to get to some in the Q&A, then we'll do that, okay? So let's get started. Dr. Patel, we have a question from a parent, Ms. Liu from Northside Learning Center. And her question is about the vaccine for kids. So if the vaccine has not been tested on kids, how can we safely say that they need the vaccine?
Yeah, so that's a great question, Ms. Liu. I think you're absolutely right. I do feel like the safety data on the population that was included in the Pfizer trial, 16 and above, there is no question looking at that data that it is incredibly both safe and effective. There's no question in my mind. I would definitely say I am not going to make, I would like to believe that data that's being assembled for 12 to 16 will tell us that it's also safe and effective, but I don't want to say that until we actually see the data. So right now, all we know is for one manufacturer that we have an option ages 16 and above. And then we know that there will be data around 12 to 16. And given just because of 12 to 16 is an interesting age, but in general, they use the same dosing and Dr. Fox is a pediatrician, so he can tell you this with a little bit more confidence. But in general, you don't necessarily see kind of a really marked difference in like the physiology of how 12 to 16-year-olds respond to vaccines. it's the younger. I think a lot of us are really kind of interested in the younger age groups, but you're no doubt, Miss Lou, the data needs to be there for it to be safe and effective. And right now it's not for under the age of 16.
Thank you, Dr. Patel. Dr. Fox, is there anything you would like to add?
No, that's great. I mean, I totally agree. But you really hit the nail on the head when you mentioned that, you know, kids are not just little adults. Their bodies are different. And this is especially true in the kids younger than 12. Yeah.
For sure. Thank you so much for that, Dr. Patel and Dr. Fox. The other question that we have is from Ms. Barners from Vanderpool Humanity Academy. And the question is, how do we explain vaccine safety to the younger children or teen as the trials are going on with youth? So how do we explain this vaccine safety to them?
Yeah, I think I mean, I'll try to be brief so we can get through as many questions as possible. And I realize looking at myself, I look super dark for some reason. So I'm going to try
You're
to,
good.
I'm going to try to make myself so you can, now I'm trying to hide my face from you. But I think the way we explain it to young people, I never believe in sugarcoating anything. I think we explain to young people exactly what the goal of clinical trials are and how we make sure that they stay safe. Good news is that these are phase 3 trials. So it's good to explain to people what is phase 0, 1, and 2, and how do these vaccines get developed. And also just something I'm just going to offer, since there are different, in vaccine development, we call them vaccine technologies, and they're a little bit like the technology in our iPhones now. We can actually program the technologies, and there's different ways to make a vaccine. And I think young people would actually be fascinated by it because it's amazing that we now have genetic code and that we can take that genetic code and program a vaccine, which is mind-boggling. So I think walking them through that messenger RNA is not new. It's new for this vaccine. We use messenger RNA for treatments for cancer and for all sorts of things. And then explaining the genetics of, it doesn't interfere with your cells. And so here's what the vaccine does and here's what it doesn't. And really, I think I brought up the diversity piece because our country, let's face it, has had a history of using people of color and communities for unethical experiments. And I call them experiments because that's what they were. So it's important to also be transparent about who is included and like how the federal government is making every attempt to safeguard people at all ages. And I feel I will be honest, I wanted to volunteer for one of these trials. I didn't get a chance to. I would have done it because I think that's the way we get a broad representation and that we answer the question about how to keep people safe while they're in trials.
For sure. No, thank you so much, Dr. Patel. Dr. Fox, anything you want to add?
I just think only thing I would add is, how you explain it depends on the child's developmental level. For a small child, I'd be saying something like, grandpa got his medicine in his arm. I just became a grandfather, actually.
Congrats.
But, grandpa got his, mama got hers, and now it's time to keep you safe. And this is how we're going to do it. It really works good, and it makes it safe for us all to be together and for us to do the things that we all love to do. For a teenager, you can get much more detailed. I mean, somebody who understands science and understands history, can really appreciate the story here, which is a tremendous chapter in human history, really, if you think about it, that access to safe and effective vaccines changes the world. I mean, you could ask a teen, oh, do you remember polio or the measles? And of course, they don't remember that. And there's a reason that they don't remember, okay? Because they're safe and effective vaccines to prevent those illnesses. So I think that you just point out kids are very appreciative, I think, at all ages of just keeping it plain and say, these things like polio and measles were once great killers, right? They're not eradicated from the face of the earth by any means, but in the US, I think that's true. And the reason why they're not is because they're safe and effective vaccines. So I would tailor it to what the kid is really asking you and tailor it to the child's developmental level.
For sure. No, I can appreciate that. My 12-year-old has tons and tons of questions, and I have to go online and go to the CDC website and look it up and share with him because he wants to know and he is curious and he's very visual, so he has to see. So yes, I think definitely you guys know your kiddos and you know what you can show them and what you cannot. So thank you so much to the both of you. The next question that we have is from a parent, Ms. Ayeska from Mary Greg Peterson Elementary. And she has two questions, so two-part question. The first one is, what brand of the COVID vaccine is the one that doesn't give a lot of problems or consequences? I'm assuming side effects. And her second part of that question, she suffers from year-round allergies, right? So like stuffy nose, runny nose, itchy eyes, that kind of stuff. She takes the allergy shot because the, medication, the other one doesn't have an effect on her. So her question for that is she considered high risk, right, on taking the vaccine? And would it be safe for someone like her to actually take the vaccine? So two-part question.
Do you want me to, Ken, do you want me to try answer? Okay, so tells you I'm getting, Dr. Fox may be the grandfather, but I feel like sometimes I'm definitely losing my memory, which is not good. Let me take the last part because I was just
Sure.
on the allergy question. Now I remember the first part. On the allergy issue, no, that should not be a contraindication to getting the vaccine unless you take an allergy shot because, not for seasonal allergies, but because you might have had an adverse effect from something that makes your throat close and your heart go faster and not be able to breathe or speak because your tongue is swollen, and called anaphylaxis. Doesn't sound like that's the case. But no, just getting those shots because you have seasonal allergies does not mean that you can't get the vaccine. You can get the vaccine. And remember, everybody's going to be asked to wait for 15 minutes after the vaccine, no matter what, because of just wanting to make sure, even people who don't think they have an adverse event, just to make sure. And then to the first part, there really is no difference. The amazing thing about these two messenger RNA vaccines is they're so similar down to the side effects. So my own mother, she's my litmus test. My own mother is like, which one should I really get? And I said, honest to hand to God, any one of them that you get, there is no reason to, I'm truly saying this. I got Moderna, my mom got Pfizer. I would have been happy to take the other. There has not been any demonstrable significant differences between the two. I just say though, all of them have had those side effects, injection, very high percentage that get those side effects. It just means it's working. But do not hesitate if you do get those side effects and you're worried, absolutely reach out to a health professional, nurse, physician, anybody to make sure that it's not something else. And common myth that I did not put on the slide, I have had so many friends who are physicians and nurses who got their first shot, were feeling super invincible and went out and did a little more than they thought, got their nails done, went and got their first haircut in 10 months, and they got COVID. So just to say, do not let the confidence of that first shot, even though we do know it starts to build some immunity, give you the hubris or kind of the arrogance that you shouldn't keep the masks and do all the things that we're all tired of doing.
Yeah, no, thank you so much for that and for emphasizing that, right? Even if you get the shot, you still have to be careful for yourself and for the safety of others. So thank you so much for that.
We've got to make sure everybody in CPS understands that.
Yeah.
While vaccination is happening, we still have to keep those mitigation practices in place. Those layers of protection is super important.
Yep.
Yeah, no, thank you so much, Dr. Fox, for that. And going around in the same kind of questioning, we have a question from Ms. Custodio from Phoenix Military Academy, and her question is about the vaccine. Will the vaccine be a seasonal vaccine like the flu shot?
Yeah, and I think it's the thing about COVID is that every time I think I understand something, I'm proven wrong. So, but I do feel like the presence of these variants and just the way we're seeing, the surges and things like that, I do think there is going to be a seasonality. Is it going to be every winter with your flu shot? Maybe. Is it going to be every 2 years with, a flu shot every other year? Maybe. So, but this will not be your last set of vaccines. I guess that's the better way to say it.
Yeah. And I'm going to combine a couple of questions because they're kind of similar vaccine for kids, right? So the question from 3 parents from across the district were, are they going to be available? When are they going to be available? And are all kids going to be, will have to vaccine once the vaccine becomes available?
I'll take parts of that, and then Dr. Fox, I'm curious, he's the real scholar in children. I'm just a fake one with kids myself. But I have looked at this issue because it is important. And I did mention, like, and again, let me be clear that I think there's a good reason the kids will be the last population to be vaccinated for all the things we just talked about. But yes, I do think that we will have a vaccine option by at least fall, maybe earlier for 12 to 16. And then again, I mentioned the next age group down is 6 to 12. Just a little bit of a fact, in order to recruit for these trials, they look for people who are vaccinated and those who are not, and how many cases of COVID. The less COVID we have, the longer it takes to enroll in these trials. And so it's possible that, we'll see 12 to 16, but it's possible it could take months to see 6 to 12. So I have been very I like to be pleased, not disappointed. So I would say this year 12 to 16, yes. Under 12, maybe, but definitely by next year we'll have the data for the ages underneath that, which poses a risk. And I don't mean that to sound trivial. It's just that Dr. Fox and I have not talked about this. That we did not rehearse any of this. There's this interesting debate, like, will children who can't get vaccinated need to wear masks? And I blindly just said, yeah. I mean, I just kind of blurted it out. I'm like, yeah. And I think some have pushed back against me. Well, why? If there's herd immunity and the level of the virus is decreased. And I said, because I just don't know if the mask is that hard to wear, and I think it protects people. So I think that's going to be an interesting conundrum that we'll have to face probably in the fall as we have more, as hopefully majority of adults are vaccinated.
Yeah, thank you so much, Dr. Fox.
Agreed. I think you're right on target there. I think it's very unlikely, that there would be vaccine for the younger set anytime in 2021. Let's just face it. And about the mask thing, I think that is such a great point. There were people who were saying, "Oh yeah, no, kids are never going to wear a mask." No, turns out that assumption was wrong. I see kids all the time with their mask. They wear it. They model what they see, and they want to be, they want to get back to their, routine as to the extent possible. If that means if I got to wear a mask in order to play, I'm wearing a mask. That's what the kids seem to say. So kids have demonstrated the ability to be resilient and to, go with the flow. And, you work it out over time. You work with the kid, but they can do this. They can do this.
Yeah, no, thank you so much for that. And as we're reopening, right, with some of our kids already back in the building, it's so important to keep saying that to all of our kids: wear your mask, wear your mask. And it becomes, I think, at some point, it'll become second nature, right? Before we go outside, you take your keys and your cell phone, you're going to take your mask too. So thank you so much for that, the both of you. And want to move along. One thing that you mentioned, there's a question along the lines of like, once I get my vaccine, what can I do, right? So I have a question from a parent that says, once they have both vaccines, the first and the second shot, can they travel internationally?
Yeah, international travel is going to be yes. I mean, you can, technically you can travel now internationally. It just requires, especially on the return testing, et cetera. I actually do think that that's going to continue to be the case. Remember, the United States is very blessed. We're way ahead in accessing vaccines than many countries who will have no access to these vaccines. And so traveling internationally is going to be something that, yes, I would say will be safer to do once you've had both doses, but it is not without its own risk, because you could be fully vaccinated, still get the virus. And we do need that data, although I think it'll come through that you don't necessarily give the virus. So I do think that while we're in this kind of in between period this year, especially, I think we're going to still see requirements for testing, and candidly, because many of the people are parents, if you have children who are not vaccinated, you need to enter that in. I think risk needs to be calculated based on your circumstances. There's a lot of things that go into risk. Dr. Fox showed that incredible graph from the CDC and that document. but you have to take it down to like what's happening in your neighborhood and in your household and you as an individual. And then you add up the risk. Getting the vaccine decreases it a lot, doesn't take it to 0. And then traveling internationally increases it a little bit, doesn't take it to 100. And then returning from the international trip takes it a little higher too, but again, not 100. So you'll have to ask yourself, what is the level of risk I'm willing to take? I have not done any. I am super lame. I have done nothing other than go to clinics and hospitals and my lovely Zoom area. And it's because I don't want to take a risk. And that's me. But I have colleagues, physicians who have been to South Africa, who have been to India, and have felt very comfortable because of their willingness to take risks. So think about your risk as an individual and kind of the environment around you. And don't just let the vaccine alone is not going to take away the risk.
No, thank you so much and I'm with you. I'm on the lame team, so no worries.
I'm on the lame team. It's okay.
Yeah,
it's okay.
it's cool.
It's all right.
It's cool. Thank you for that. One of the other questions, I think we're going to do our last question. I saw some in the Q&A and they're very similar. For people who have already had COVID, right? Do they need to get vaccinated? That's one part of the question. And the second one, some of them had, some pretty not horrible, but bad effects. Will the second shot or portion of the vaccination, will then make them feel as bad as they did when they had COVID?
Yeah, great questions. Yes, if you have had COVID, with the exception of people who might have received plasma treatments or something called monoclonal antibody treatments, those people might need to wait 90 days. That's what the general recommendation is. But if you've had COVID and you've recovered, two things, it's been at least 10 days and you've recovered from your symptoms, you can get your vaccines. And definitely, if you're, again, I always say, if you're confused, please reach out. But yes, you can get your vaccines. And I have not seen that second or even that first shot kind of reproduce. Remember, the goal of those shots, it's like a messenger, like FedEx. It comes, it delivers a little package, it tells your immune system, get ready to rumble. Doesn't actually make you rumble. So I do not see that, but I don't want to minimize. It is normal to have those. I truly felt like I had the flu. I mean, I was under the covers, 5 covers, 85 degrees temperature in my room because I felt so cold. So that might make you feel like it was the way you felt during COVID, but it is not because you got, it's not because you got the vaccine. And it gave you something. It's because the vaccine is getting your immune system to kind of recognize and develop memory, punch it out, and then cool off, and then be ready for when you do get introduced to the virus again.
Yeah, no, thank you for that. And I think something very important you said, right? If you have questions, call your doctor, right? Like reach out to somebody that knows I think your doctor, call your doctor and ask these questions.
CDC.gov actually has, like, for a lot of the criticism the CDC gets, I sometimes am one of them. The CDC has good infographics, videos. I wish they were a little more like your CPS webinar was more language friendly than many of these materials. So my only other plug is that for those of you that speak other languages, to really help people understand this, because we're not doing a good job of getting vaccine information out in multiple ways. So definitely ask a provider, but I'm totally aware that like the most reliable person in your community might be like the really smart person that works in the barber shop down the street, because he or she is like really up on reading some of this stuff. So find a trusted member who can really tell you some really good resources, and then ask questions. Ask. It's important. Your lives are important. Your children are important. Ask. No shame, no dumb questions.
For sure, yeah, and we'll send all the links that we've talked about today on the email that we'll send tomorrow. So if people don't freak out that what did she say? We'll send them out to you guys tomorrow via email. So no worries. I know we're almost running out of time. So Dr. Fox and Dr. Patel, I want you guys to think there's a lot of information, a lot of really good information. Obviously, our parents had a lot of questions, but from everything that you guys said, what are some of the 3 main points that you would want people to take away today?
I'm going to let Dr. Fox get the last word, because he is like the OG of like what the community really needs. My biggest takeaways, like number one, I kind of said it, please ask questions. There's more questions, it feels like, than there are answers, but there are answers, you just need to ask. Number two, these vaccines are incredibly safe and effective, and I can't emphasize that enough. I think that there's a lot of reason to be skeptical about a lot of things related to COVID. The vaccines themselves, given what I have seen in the hospital and clinics with people who get this, including children, these are just something where I feel like the benefit does outweigh the risk, but it's not zero. So I think that's important. And then the third is the fact that COVID will be with us kind of, I don't want to say forever, but I feel like we will be living with COVID and finding a way, which is one of the reasons I feel like schools and teachers and these issues we'll be living with COVID. We need to find a way to kind of walk and chew gum and pat our head and do all of that. And that's what we're doing. So there's no easy answer, but there are answers. So those are my kind of top three messages.
Thank you so much, Dr. Patel. Dr. Fox?
Sure. I would say if there are three, I would say the first is that what we must do is prevent illness and prevent suffering of all kinds, right? We want to promote the health of children and families and communities. It's really as simple as that. The second point is that, the CDC guidance that we talked about, that new guidance, it's a useful tool to help us accomplish that basic mission. And it really affirms the approach to in-person learning that CPS has put forth. And the third point, and what we spent the balance of our time, the most of our time talking about, is that the vaccine is one tool. It's one tool in the toolkit, but that the other mitigation measures, those other layers of protection are still incredibly important, and we have to continue to use them.
No, thank you so much. And thank you so much for reminding us of that. We still need to be diligent and do our part to keep everybody safe in our house, in our neighbors, and in our community. So thank you so much. So Dr. Patel, Dr. Fox, thank you so much for giving us your expertise. There's a lot of really good information. Thank you so much for your time. For people who join us today, thank you so much for giving us your afternoon. I know everybody's tired of shoveling snow here in Chicago. It snowed a little bit before we started, so we might need to get out there again and shovel a little bit more. So thank you so much for joining us, and hopefully we'll see you guys next week in our next session. Thank you, everybody. Have a good one.